Do you know that more than 34 million Americans have diabetes? And every year, an estimated 34,000 people in Wisconsin will be diagnosed? November is Diabetes Awareness Month, and we're here to talk about type 2 diabetes.
Became ill, which led me to an ER room, and I was hospitalized and ended up having 2 surgeries due to an infection. They felt that the infection was triggering a high A1C along with being a diabetic. Looking back, I felt that maybe I did have some symptoms of diabetes, like probably 6 months prior, I felt that I was really tired, but I just ruled it out to just working too much and just my lifestyle and stuff like that. But when I look back, I did. And then also, it seemed like a increased urination, but I kind of just brushed that off as I had started to try to force myself to drink a lot more water. When I was laying in the hospital bed, I remember vividly thinking, was I going to be insulin dependent? How was I going to manage my blood sugars? And how my diet was going to change dramatically. I was nervous about the cost of some of the new diabetes medications out there, and does my insurance pay for it? What if they don't? How can I afford those medications and things like that? And I hear other people say I can't afford the medication, but as time goes on and learning about the different medications, there are a lot of programs out there to help assist pay for them, you know. And there's, like, if you go directly to the manufacturers of these medications, they can assist you in getting very low copays. Where I started, my A1C started at 11.9, and within 7 months, I have dropped it down to a 5.6. Well, the first thing I changed was my diet. I had to learn what I could and could not eat. You know, I had to learn about carbohydrates, and I had to really learn how to read food labels. You know, and then it was checking my blood sugars, learning how to check my blood sugars, how often to check my blood sugars. You know, it was learning, you know, after I ate, how long do I wait to check my blood sugars to see what my blood sugars were doing. And then after a while, you know, meeting with a endocrinologist and learning about diabetes and getting on different medications, I had to try different medications. It was a trial and error. First of all, I was put on metformin, and I really developed some side effects to metformin, so then we were able to switch, and I started on Ozempic, and then I started on Jardiance, and that combination has worked very well for me, you know, getting my blood sugars down. And losing weight was a big factor too, but counting your carbs really helps you lose weight. I could see that my blood sugars were steadily dropping, and if I did eat something as higher carb, I could see my blood sugars spiking.
Okay.
I was monitoring that very closely. And then I did get a CGM, which is a continuous glucose monitoring, which I use as a very tool for me. Mm-hmm. You know, you're supposed to check your blood sugars after you eat and see. I got real tired of poking my fingers, and sometimes my lifestyle was not, I was not always at home or the convenience of having my glucose check monitor with me. And I always question, oh, I ate this, how did it affect my blood sugar? With technology and this, it was very easy for everybody seems to have a cell phone, smartphone nowadays, and I was able to scan right away on my monitor. And the CGM is a very good tool for me. I use the Freestyle 14-day Libre. Change it out, wear it for 14 days, change it out. I found it was very easy to use. It was not difficult. If you have a smartphone, it works wonderful with a smartphone. Otherwise, it just has a meter that you can scan, carry with you. You always question, well, how is my blood sugar doing? Because if you only poke your finger 3 times a day, some type 2s only poke it once a day. Some type 2s don't even check their blood sugars. I would want to know, it feels that I'm in control of my diabetes. I feel it's important that you ask your provider if you are pre-diabetic. Sometimes people don't go to the doctor, they go once a year to the doctor, and you know, or even not even once a year, but if you're feeling some signs and symptoms, we have the direct access lab that you don't need a doctor's order, and you don't need to go through your insurance. You can just come in, make an appointment, come in, have your A1C drawn at a discount price, talking to other diabetics and talking about diabetes with everyone. You need to figure out how many carbs per day, net carbs, works for you and how it affects your blood sugars. And you need to monitor your blood sugars daily, several times a day, and learn what carbs work well for you, what carbs do not, and eliminate the carbs that do not work for you, and try to get your blood sugars under control. And the big thing is learn to read labels on food products. You'd be very surprised what you think might be low carb really is not low carb. Continuous high blood sugars is like taking sandpaper to all your veins in your body and the damage that it does to them.
At Cumberland Healthcare, we offer diabetic and nutritional services. We can help you understand prediabetes and work together to improve your blood sugars. We offer diabetic support groups and education on a group and individual basis. Call us today to get started.